Hey, it's Jessica DaMassa with WTF Health. I'm here at Frontiers Health, and joining me right now, I have Sakshi Chhabra Mittal. She leads investments for the Softbank Vision Fund. It's so good to have you with me. We're going to get some good advice for those health tech startups out there. So first of all, tell me just very briefly about your fund and the types of investments that you lead.
So Softbank is a $100 billion technology-focused fund. We think of a vision for the next 5 years, 10 years, but also for the next 300 years. We're very excited about the role of data and technology disrupting large markets, and healthcare is one of them.
Perfect. Okay, so for these healthcare startups out there, I'd love to pick your brain and just get some very pointed advice. So a lot of times, they struggle with business model, where it's they think they've got a good business model, but their corporate client, either like a health plan or a large pharmaceutical company or a more healthcare established institution, will look at their business model and be like, there's really not so much in it for us. So when you're looking at a healthcare startup and you're evaluating their business model as something to invest in, what do you look for? I mean, are you looking for things that are very disruptive, new ways of financing and funding things, or what would you recommend?
Yeah, so I think there are two separate questions here, right? So the things that we get excited by when we look at healthcare companies, and the second question was around recommendation or what works well. So I'll address the first one first. Things we like are both, new science, new technology, where obviously revenue or commercialization is still kind of further down the line. But they have proven themselves to be this strong technology leader, which is going to lead this market post-commercialization. And we're happy to support those companies. Our minimum check size is 100 million. So by the time you apply that filter, very few companies in that area. And then the second thing we do get excited by is kind of post-commercialization companies, right? So when you think about digital health, a lot of these companies are revenue generating, they have a very sticky user base. So, just like kind of any consumer company or any B2B company, we look at their metrics, and it has to be quite late in its commercialization phase, quite a mature company for us to get excited by, because we are late stage investors. Now, moving on to the second question, which is, advice for...
Yeah.
So based on, the companies I've seen, the things that I get excited by within healthcare specifically, because healthcare is a very special market, right? It's really tough. It's very regulated. It's got these like 4 critical players who end up playing the parts of, consumer at different stages. These players are payers, providers, patients, pharma. So the companies that I end up liking are those that from day one speak to each of these players and have them on board in some shape or form.
Okay.
Like you're now starting to see, companies get really clever. Startups get quite clever about this stuff. On their cap table, you'll find these strategic investors. So they've obviously spoken about their business model. They've convinced them about their business model. And that kind of gives us as investors, a huge level of comfort writing larger checks into these companies.
Yeah. And I mean, it's interesting you say that, because you said you invest in later stage companies, which is exciting because, I mean, it seems like there's a difficult jump between an A and a B, and then subsequent rounds after that get a little bit murky as well. Yeah. So what would be your advice for a startup that has closed their A and is looking for a B and looking to kind of extend and I guess mature as an early stage company into a later stage startup?
I think, from our perspective, we've seen some, really big success stories in kind of hyperscaling, right? So, we like to follow...
hyperscaling.
like, things that kind of forget A, B, C. Just like, if you found the product market fit, it's working, just go crazy. Just go fast and scale and acquire market leadership. That's the kind of stuff that we get really excited by. It's not so much kind of profitability, for example. Like that we know will come,
So you're looking more for numbers. You're looking for users and stickiness.
Users, revenue, or even just the science. Anything you do, we're looking for market leadership.
Okay. I wanted to ask you about pitching, because this is often something that a lot of startups, wonder about, worry about. They hate doing it after a while. So from an investor standpoint, what do you have to say? What would you advise a startup about pitching?
I think, honestly, be to the point. We just do not...
you don't want to hear it either.
As investors, you end up hearing, so many of these pitches that you obviously have this ADD disorder that you end up developing. So that, your attention span is quite small. So I think just stick to the point, help us understand the problem you're trying to solve and how you're trying to solve it and how you're going to be the winner, and that's it.
Okay. Is there any one thing in a pitch, like it's like sometimes like the lead in with like the statistics that get to try to solve the problem. Is there anything there that you feel like, God, just cut this, cut this down to the point? If you were going to give us some specifics, what kinds of things would you say to eliminate?
I think exactly that. So I think what people end up doing
good.
is
I hate that too.
Yeah, no, I think it's exactly that. Like people just end up going on and on and on about the problem. We understand the problem, right? We're all kind of smart enough. We've been in the sector. Just a one slide would help. 10 slides, end up losing us.
You're losing us.
I agree.
Focus on the solution.
Yeah.
And then as far as the solution is concerned, how disruptive does it need to be? I mean, for SoftBank, so I mean, every investor has a different thesis that they're working on, right? But I mean, for you guys, I mean, you're looking for market leadership, you said. So does that necessarily mean really disruptive? I mean, put that into some context for me.
Again, like the word disruptive has so many different definitions, right? Like you could be disruptive in terms of just your MAUs. Like you could just have this amazing product, which just has a very, very sticky consumer base and people just sign on organically, and that's disruptive, right? There might be a very similar product out there on the market, but it's just not as good. Or it could be disruptive in the sense that this science is just brand new. We've never heard of something like this, and you're trying to attack a problem, with a very interesting solution. So I think what we look for is just superiority in technology or in business model or whatever you do, just be the best at what you do. And we're happy to give you a large amount of capital to just do it at a crazy scale.
Okay, that's it. We're just happy to give you a large amount of capital. So last question for you. I wanted to ask, because I know your focus is truly global. You guys have offices in different parts of the world. And oftentimes we hear, especially in healthcare, oh, well, my healthcare system in the US or in Europe or in Asia is so different from any other healthcare system. I don't know how I'm going to scale overseas. Do you think there's any merit to that? Or are we really all, I always feel like we're all trying to solve a lot of the same basic problems. So if you can get it to work in one market, you could probably get it to work in another if it's something that attacks cost or improves access or things like that. What are your thoughts on that? Can you really take like a healthcare solution and scale it globally? What do you think?
Yeah, so I think it depends on, what segment of healthcare you are in, right? Because it is a very, very regulated industry.
Sure.
So like say a doctor that can consult online in the UK, for him to consult online in India or in the Middle East, might need some kind of a cross-border license or something. So, keeping the regulations aside, I think, it is absolutely possible for models to be global, and you're seeing companies going global. I mean, you look at cancer or liquid biopsies or genomic testing, and, 23andMe is based in California, but is selling its products everywhere in the world. So I think you're definitely going to see a lot of that, but you do have to keep the regulations. You have to kind of work around them.
I love that. Work around the regulations. Go big or go home. Good advice. Thank you so much for joining us. It's a pleasure to speak with somebody who's got such a broad insight on the industry, and not only in healthcare, but just generally in investing. So thank you so much for stopping by. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.